Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Post splenectomy care. So first let's look at vaccination. So first is the vaccination. So here in vaccination, the patient should be vaccinated at least 2 weeks prior. So at least 2 weeks. 2 weeks prior. And ideally it is about 10 to 12 weeks prior to the elective splenectomy. So it is ideally 10 to 12 weeks. 10 to 12 weeks. And this has to be prior to the elective splenectomy. So the elective splenectomy. Next is when the vaccines cannot be given prior to the emergency splenectomy. That is when the vaccine cannot be given. The vaccine can't be given. And this is prior to the emergency splenectomy. So this is prior to the emergency splenectomy. And the vaccine should be given at least 2 weeks prior to after splenectomy. So it is given at least 2 weeks prior after splenectomy. After the splenectomy. Now moving ahead, there are some following vaccines are given. So what are these vaccines? So there is a pneumococcal vaccine. So there's presence of a pneumococcal vaccine. So this pneumococcal vaccine, a dose of about PCV13, and this is followed by the PPSV23. So it is greater than 8 weeks. Later is advised. So PCV13 followed by PPSV23 greater than 8 weeks later is advised. Next is there is a revaccinate. So we do a revaccination. So it is revaccinated every 5 to 7 years. So every 5 to 7 years it is revaccinated. Then we have the H influenza. So in terms of the H influenza, it is a type B vaccine. So type B vaccine of H influenza. So here a single dose of the HIB vaccine is recommended. So one dose of the HIB vaccine. This is recommended. And there's a revaccination is needed every 10 years. So every 10 years you do a revaccination. Next is we look at the meningococcal vaccination. So what is special about the meningococcal vaccination? Meningococcal. So here in meningococcal vaccination there is a 2 dose of the ACWY vaccine. So there is a 2 doses and this is of the MEN ACWY vaccine. So this vaccine is given it is greater than equal to 8 weeks apart. And there is a revaccination is needed every 5 years. So there is also the revaccination. So this is needed every 5 years. Lastly, there is a influenza vaccination. So in terms of influenza vaccination, the vaccine is against the seasonal influenza. So this is against the seasonal influenza. So this should be given annually. So it is given yearly. Now let's look at the antibiotics. So in terms of the antibiotics, the daily prophylaxis, it includes the penicillin. So there is penicillin and also the amoxicillin. So there's penicillin as well as amoxicillin. They are the preferred agents. So for at least 1 year after the surgery, this is given at least 1 year after the surgery, and at least up to the age of 5 years in children. So up to 5 years, and this is in terms of the children. Next is the involvement of the immunocompromised. In terms of immunocompromised, it is at least up to the age of 18 years. So up to at least the age of 18 years. So this was in terms of the antibiotics and the daily prophylaxis. Next is we look at in terms of the early empirical. So in terms of the early empirical, what do we have? In early empirical, the treatment, it is to be initiated in the presence of the systemic symptoms of infection. So in terms of the systemic symptoms of the infection, and this includes chills. So there can be presence of chills, there can be presence of the rigor as well as the fever and vomiting. So these are a few to mention. And there is the amoxicillin. So there is amoxicillin as well as the clavulanic acid, so CLAB acid. So this is preferred choice in terms of the most of the adults and children. So it is present in adults as well as the children. So if there is an allergy to the beta-lactam, so in terms there is presence of allergy. So allergy is found at the beta-lactam. So what do we do? So in terms there is allergy to the beta-lactam, they use the levoflox. So levoflox is given as well as the moxiflox. So levofloxacin as well as the moxifloxacin is administered. Now let's look at the antithrombotics. So in terms of the antithrombotics, so in case of the antithrombotics, there is a low dose of heparin which is given. So there is low dose, and this is nothing but of the heparin. So low dose heparin is given, and this is at least for 4 weeks. So it is given at least for 4 weeks, and this will help in the perioperative thromboembolism prevention. So this is going to prevent the perioperative. So it is going to prevent the perioperative thromboembolism. So it prevents the thromboembolism prevention. And next is in the presence of the extreme reaction. So in terms of the extreme reactive thrombocytosis. So in terms of the extreme reaction thrombocytosis, that is by value you can tell that it is greater than 10 lakhs per mm3, and as well as the low dose aspirin it may be given. So as well as the low dose, so there is a low dose aspirin which is administered. To learn and grow daily like this, please do subscribe.